Hello, Dr. Mulholland, Spa Medica, Toronto. It's quite amazing what we can do now with non-surgical techniques. Simple injectable products. We have a whole family of them. The Botox products for elevating brows and softening animated muscles. Soft tissue fillers for bringing back contour of deflation. Products like Kybella and Belkyra, which melt fat. 5-minute nose jobs, lip augmentation, shaping the jaw muscles. We can do so much with injectable fillers. I thought it would be very interesting to follow one woman's journey 1 week at a time and see the incremental changes some of these amazing non-surgical products can bring. And we look at the before and after week as we build upon the modules of injectable transformation. The first step in injectable transformation for our young lady, let's take a look at our young lady here. We're going to get her to sit up a bit, and we'll just look at things from the front view. From the top down, she has some worry lines, the brows are a little low and there's some hooding. We want to get a little Botox brow lift. She has a little nasal irregularity with a bit of a bump and a boxy tip, and we're going to soften and feminize that with an injectable rhinoplasty. There's a little typical loss of volume under the eyes. We're going to bring that back with injectable under-eye non-surgical blepharoplasty. We're going to soften around her mouth lines, enhance the lips with soft tissue fillers. We're going to make that square face look a little more oval by softening her jaw clenching muscle called the masseter. Clench your teeth right there, the strong clenching muscle, the masseter. Little Botox in the masseter will soften the square look and will make her more oval, and will strengthen the jawline with fillers. And finally, the little double chin we'll treat with Belkyra. A total injectable makeover from the bottom of the chin to the top of the forehead, 1 week at a time. Our very first product is Botox. Good old-fashioned Botox. Been around since 1983. Tens of millions of people have been injected. Very safe product. It relaxes muscle. One of the muscles we're going to relax to change the shape of a face is the square muscle on the side, the jaw muscle, the masseter. If we soften that, shrink it, we make the face more oval. Let's take a look. So our young lady here has a very strong masseter, a square jawline. We want to make a more oval face. We simply take our Botox. We get our young lady and patient to clench. You can see the strong jawline there. We take our Botox and a very tiny insulin-type needle. We inject right into that clenched masseter, and we make little injection points all throughout the clenching jawline. And over the next 2 to 3 weeks, the jawline will shrink, the masseter will shrink, and we'll take a square angle of the mandible, minimize its appearance, and we'll be able to highlight the cheeks. We'll get a lift effect. An oval shape will ensue and give her a very nice contour improvement. And so once we've done the injection of the masseter on this side, very simple thing to do, we're simply going to turn the face and do the same thing on the other side. I think you can see, take your hand up here and hold a little pressure. Right here, clench your teeth. You see that strong masseter? It jumps out at us. If we can shrink it in this direction, the face will be opened and more oval. We'll highlight the cheeks, minimize the jawline, and create a different, softer, more feminine look to the face. Clench. We grab that strong masseter muscle, and we inject our Botox with our very small insulin-type needle, and we go down right into the muscle, and over the next week to 10 days, that muscle will weaken and then atrophy and shrink, and her jawline will improve. Now that's step 1 of our jawline improvement, masseteric reduction using Botox. Little pressure on the other side. Now step 2 in contouring your jawline is going after the waddle, the little double chin. We're going to use another chemical called Belkyra. In the United States, this is called Kybella. This product is a fat killer, a double chin killer. We're going to use Belkyra to inject the product called deoxycholate, which is the same chemical released from your gallbladder when you eat McDonald's French fries. And it is made to dissolve fat. So it's a very natural product, no cross-reactivity. Come off there. We're going to go after the waddle with our waddle killer, Belkyra. So we take our mixed up Belkyra, which is a simple bile salt released by the gallbladder. when we eat fatty foods. Our fatty food is now collected under the chin. We dissolve our fatty food through the skin with our product. We grab the double chin, we take our Kybella or Belkyra, depending whether you're in the United States and Canada. We inject directly into that little double chin, that little fatty area. We're going to make that little double chin go away. It creates a little bit of burning and discomfort, but it works almost immediately to dissolve the fat. Week 2, One Woman's Journey, bottom floor, masseter, double chin. Today, Botox Brow Lift. We're going to use this dissolved product called Botox, a simple protein, to inject into specific muscles. We're going to inject into the muscles that pull the brow down, to allow the muscles that pull the brow up to work with no competitor, with no antagonist. So our Botox is going to put to sleep the depressors of the brow, to allow the elevators to act without the tyranny of those depressors. We are going to free up the brow with what's called a Botox Brow Lift to look smooth and elevated. Botox can act not just to relax lines, but to shape faces. And today, we're going to see a Botox Brow Lift. Botox Brow Lifting, we're going to look at the various muscles that pull your brow down and the muscles we recruit to lift your brow up. And it's like a tug-of-war of the puller downers, called the depressors, and the lifter uppers. And by the strategic use of Botox, we can uncouple the muscles that depress or pull down and allow the elevators to permanently lift the brow until the Botox wears off. So let's take a look at our young lady here today. So I'm going to have you look in the camera. We're going to zoom into here. Big frown. Relax. Big frown. And so when she frowns, like all patients, she pulls her brow down. That's the depressor number 1. Relax now. Big smile. Big smile. When she smiles, relax. Big smile. She pulls the tail of her brow down. So relax your brow. We have 2 depressors, the central depressors and the outside or lateral depressors. And if we put these groups to sleep, lift your brows up, we've got a very strong elevator. Now if we can modulate the elevator so it doesn't leave those lines and get just the tail to kick up, we can get a Botox Brow Lift. So that's our goal, a passive Botox Brow Lift where the tail is higher than the head, which gives a nice elegant contour and shape. We do that through the intelligent use of anatomically placed Botox. Step 1 of the Botox Brow Lift, an alcohol wipe to sterilize the area. We're going to be focusing on the groups of muscles that pull the brow down and relaxing them. We're going to soften the pull-up muscle so we get a nice lift and a relaxation. So we want all that skin to be nice and cleansed. Once we've done the isopropyl alcohol, we can start doing our injections. I usually start with the central or middle depressor, so be angry. There's a very strong puller downer, relax. I grab the muscle that's pulling the central brow down. I take our diluted Botox, a simple protein, a very small insulin-sized needle, very, very comfortable. We rotate this in so there's no sharp pain, and then I inject the precise amount of Botox we need for this young lady's strong puller downer muscle to be relaxed. Once we've injected, we pull back, and again, a little bit of a bulge. That little bulge of diluted Botox takes about 20 minutes to go down, and it will. Now, once we've done one side, we would generally do the other. But before we do that, be angry again. There's a little muscle just behind that. I inject a small amount of Botox just behind it for the second part of the middle puller downer. Once I've done that, I move to the side of the eye. We're going to go after the squint muscle. You can see there's some resting laugh lines all the way around the eye. They will soften together with lifting the brow, so you get a softening of the lines and a passive elevation of the tail of the brow. We want to watch out for veins here. So again, my diluted Botox, it's usually a 2-to-1 dilution. Doctors use different strengths. 2-to-1 is a nice concentrated version. We watch out for little veins, and I make a little tiny pinprick in the skin, and we make a little wheel, and that will go down to her pull down muscle on the side of her eye and allow the brow elevation to come up. Once we've done that little dot, we do another little dot about halfway down the pull down muscle here at the middle of the eye, right here, and we are going to, again, make a tiny little wheel. Watch out for any little veins. Make a tiny little wheel there, and then we come around the corner and soften the last crinkles on the side of the eye. So for these 3 dots of Botox, 1, 2, 3, the muscle that does that is relaxed. It allows the wrinkles to be softened and lifts the tail of the brow. Now we're going to go to the other side and do exactly the same thing. We're going to go after the pull down muscle in the middle. Big angry frown, excellent. We grab that muscle. I grab that muscle, relax. Now that I've got a hold of it, I take my sterile diluted Botox. We rotate through the skin so there's very little discomfort, and we inject just the right amount to soften that very strong muscle that pulls the central brow down. Once we've injected, we pull back, a little bit of pressure, and then we're going to go after the tiny little muscle beside it that also contributes to her brow being pulled down. And so we're going to take our little Botox syringe, be angry. There's a little contributing muscle right here, and we're going to inject and relax that one. Once we're finished there, we come to the side of the eye. This is the squint. Down, and we're going to inject that squint muscle. Relax. And I inject the squint muscle, watching out for little veins, making sure that we get enough to really soften that area that pulls her brow down, and get a nice relaxation of her pull down muscle to allow the tail of the brow to come up. So we want to soften the tail, pull her downer, so the puller upper, the elevator, does that. So now that we've softened the outside depressor, the inside depressor, the outside depressor, and the inside depressors, we are now poised to get the brow lift. Lift your brows up. I hold the highest arch points with my thumb and my index finger, and I soften the lines in between. Again, my diluted Botox, very tiny needle. We make tiny little wheels in the skin. This Botox will travel from the skin down to the muscle in about 3 hours. Once it gets to the muscle, it will enter the muscle and relax the chemical called acetylcholine, and will not allow it to be released. So even though she wants to frown, wants to pull her brow down, wants to animate, it won't allow her to. So we invoke a predisposition of certain muscles to work, and the muscles that we want to work are the ones that give her her brow lift. These central forehead muscles that give her wrinkles will be relaxed. So we'll see a generalized softening of the wrinkles in the middle. The outside lifting muscle is relaxed, and it will do that. It'll give her a nice brow elevation. And this elevation should occur now over the next week. The little mosquito bites that you can see in the skin are gone in about 20 minutes. I let patients know they can put makeup on right away. The only instructions, no rubbing here, no working out, heavy coughing or straining, and after 3 hours, she can do whatever she wants. Within 3 days, the softening starts to occur. Within 6 days, she'll get her Botox brow lift. We've used our very good friend Botox, a very safe chemical used by appropriately trained physicians in tiny little needles to invoke a simple anatomical relaxation of muscles that pull your brow down. We've allowed the pull-up muscle to be relaxed and stimulated. The tail of the brow will kick up and give her a Botox brow lift. We'll see our young lady back in 1 week and see how the upper floor is doing and what's happening with the jawline.